So you say nobody should be wearing a loose fitting denture. No more dentures, okay? So for the two main categories you've already discussed, which are the people that have bad teeth that have to come out and they don't want dentures, and then the other group are the denture wearers. So when they go to your office, what are their options when it comes to dental implants?
So if you already have a denture, we can place 2 implants so the denture is not rocking, but you still have to take it in and out. It's still a denture,
okay,
but it's going to be a lot better than what the patient currently has. And then we can upgrade that also by placing 4 implants on the lower, so it's a lot more stable and it's not rocking anymore, but you're still going to take it in and out. You don't have to worry about it flying out when you're talking or things of that nature.
Now what about the upper? The upper denture is pretty good, right? Because it's kind of has suction.
Well, obviously, Randy, you've never worn a denture because my patients come in and hate their dentures. I tell all of the patients, you're going to hate your dentures. First, it's the whole roof of the mouth is covered. So if you're trying to eat anything, you can't feel hot and cold. You can't taste your spices.
Okay.
When you drink red wine, you can't really taste all of your foods and drinks. So what we do is add 4 to 6 implants on the top, and we place the implants, and we can cut out the roof of their mouth from the denture. So you're gonna have a brand new fixed set of teeth, and you can taste all your food again.
Now you have a system, and you teach this actually, we should mention, to dentists across the country, all over the country and out of the country. This 2-day, you call it a digital workflow.
Correct.
So literally, and I want to know if this is a bit of an exaggeration, somebody can walk in your practice today and tomorrow they could have an upper and lower set of teeth that don't come out.
That's correct.
If everything works out.
As long as we have time on the schedule, you'll come in for the consult, and we've done it the same day, but usually we'll set up a date and we'll have sedation, and the patient will come in, get their implants, and then we'll 3D print the teeth. And the 3D printer takes only about 30 minutes to an hour after we get the design back, and you'll have a brand new set of teeth that is designed for your face, that's made for you, so it doesn't look like it's out of place.
How soon could they eat?
They can eat right away. You're going to eat right away once you have the dental implants.
How old can you be to get this done?
That's a good question, because a lot of patients come in and say I'm too old, but we've had patients that have been 94 years old. They always say the same thing. I wish I would have done that sooner.
Is that right?
Yeah.
So 94, statistically, they're not more likely to fall out?
No, because sometimes you might have a little less bone there, but we can grow the bone on any patient. So pretty much 99% of the patients that come in, even if you've heard that you have bad gums or bad bone, we can either grow the bone and place the dental implants, and you'll be able to smile the next day.
But I have to ask you, because you talked about bone and things like that, if you've been wearing a denture like 10, 15 years, isn't it true you don't have enough bone to do this after you've been wearing a denture that long?
In the past, that would might have been true, but with our new techniques, we can grow the bone for any patient. Sometimes patients don't have any bone at all. We'll grow the bone, and they're able to get dental implants. They might have gone to 9 or 10 dentists, and they've always said the same thing: you can't get dental implants, you can't get dental implants. When they come to us, I give them the option to lose their denture forever.
Is that right? So no more dentures. You think that's the future of dentistry?
For sure.
Where people just won't, like dentures as we know them today, won't exist. They'll all be attached to something?
Well, forget the future. We're doing that now. They can come in now, and 2 to 3 days later, they're leaving with a new set of teeth.
Okay, now one of the reasons we invited you on the show is this digital workflow. And people need to know, I'm not trying to side with you. These are just kind of how you're doing it. How implants are typically done is you go to one place that does the surgery, and you go to an imaging center. Then you go to another dentist that puts the teeth on top, and then they send it out to labs that make the teeth. Your center, correct me if I'm wrong, you do both parts. You do it all right there. Is that why you're able to do it so fast?
That's exactly correct. So we have the 3D imaging in our office. Traditionally, you might have to go to an imaging center, and you'll have to come back. We do all that in-house. We'll take the 3D x-ray. We'll get you a treatment plan specifically made for you, and then we get you on the schedule. We will place the implants, and we'll design it, and we'll 3D print the teeth, and you'll leave with those teeth, or come back the next morning and get a brand new set of teeth.
So you can do this in 2 appointments or 3 appointments. That's it.
Correct.
Could you do it consecutively, like in 2 days straight or 3 days straight, or do you break it up over a couple of weeks?
We can do it consecutively. It just depends on, we're getting booked out, so we have to reserve your time, but if we have time on the schedule, we can get you in and get you a brand new set of teeth in 2 to 3 days.
So no more dentures.
Correct.
So if somebody's, let's say 75, and the average 75 person, I Googled this, is on about 4 medications. Can you be on a few medications, maybe even a diabetes drug, osteoporosis drug, and still get implants?
Definitely. Most of our patients are on a cocktail of medications, but we can screen them. We have anesthesia for them to make them feel comfortable, and all of our patients do really well. Really well.
So they're all sedated. Most of these people are sedated?
Yes.
When they do it. Now, there's different levels of sedation. What are you doing?
We're doing mostly oral sedation. Most patients are fine with that, but if somebody's really, really anxious, they have been putting off the dentist so they can are dealing with a bad set of dentures, we can do IV sedation as well.
We're out of time. Final message to the person watching this. There are the two groups. They have really bad teeth and they don't want dentures. Or they're wearing a denture and they've heard what you had to say, but they're still skeptical or afraid, or like everyone else, they don't like going to the dentist. What do you say to them?
We welcome them in. Come see our practice. Come get a treatment plan specifically made for you and see what you think.
Is it a free consultation?
Definitely a free consultation.
Do they get to see you on most of these visits?
Yes, they do.
All right. Dr. Tran, well, thank you for coming on the show.
Thank you very much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.